welcome to another edition of OB-GYN Chats. It's a platform where we allow opportunities for discussions, uncomfortable ones, but also allow you to chat online as well. None other than Dr. Simon Emvula joining us for this episode. Doc, how have you been?
I'm good. How are you doing, Elka?
Very, very great. We can't complain.
Yeah.
Almost halfway through the year.
Almost halfway through the year. We are almost there.
All right. Introduction first. Where is OB-GYN situated, located, and how can we get hold of you and Dr. David?
We are located at Lady Pohamba Hospital. The building is Demshore Suites, and we're on the second floor, Suite 8A.
Yeah.
So it's easy to access. From the second floor, there's an elevator. Very easy to access.
Great, great. And when you arrive, homely environment, and that's what we love about the doctors, customer care service. Thank you so much. Yeah. We have an interesting topic and we have to disclose what's the title, number one, and what does it mean? So it's about genetic testing. What does that mean?
Yeah, so we're speaking about prenatal genetic testing, which is to entail all complex of investigation that we do to the unborn baby to be able to pick up any genetic condition that they might have, or any genetical chromosomal abnormality that an unborn baby might have. And it can help prepare the mother and the family on the outcome of the pregnancy. It also help prepare them and to make an informed decision on what to do in case of any condition is picked up.
Yeah. So, Doc, before we get into the whole testing and the process, ethically, where does a mom's right start? Where does a fetus's right start? And what does the law have to say about it when you get an undesirable, let's say, response?
Yeah. So when it comes to the fetal rights, at the end of the day, it always starts with the mother. The mother is the one that we always give an option. But again, it's becoming an ethical dilemma because that's one of the common asked questions to tell what does the ethics involve a fetal right. But anyway, when we pick up any congenital or chromosomal abnormality based on what we got on our prenatal testing, then it's up to the mother to decide. It's always the mother who have to decide if we are going to either continue with the pregnancy or we are going to offer them termination of pregnancy. And that's the only way we can terminate in Namibia. Remember, termination of pregnancy, it's illegal in Namibia. And it's only when there is a condition that we can prove that there is a condition that if the baby is born with this condition, then it's incompatible with life, or they will be handicapped, it will be affected. That's only when we can do termination.
We're speaking about it like it's easy, but this is the difficult thing to do. From a psychosocial support, psychologically with parents, doctors, you see the families come and go, and this is real life when it happens. How strong should a family be, and what are those, let's say, psychological things that a family should take into consideration when making such decisions? Genetical
disorders, they are not so common. But we screen for them for every pregnancy. But the issue here is that it's always come with counseling. We have to prepare the patient that we are going to do a prenatal counseling, testing, that we might pick up a condition such as Down syndrome, Edwards syndrome, Patau syndrome, or any other structural abnormality. Then we have now to give the mother that option. But it can be very complex and also difficult to especially when you have a condition where you can't really say the severity of it antenatally. Let me give an example like Down syndrome. Down syndrome means in cases where it's only a chromosome that you pick up, which is abnormal, but sometimes if there's any structural abnormality, like there's no heart defect, the baby looks fine, so you can't really tell how will be the function, how functional will this baby be when the baby is born.
So only after birth.
Only after birth. Okay. That's where now it becomes very difficult also for a mother to make a decision that should I continue with the pregnancy, should I consider termination, because you don't know that if you are going to terminate someone who's going to be functional in society, because we have people with Down syndrome who are functional in society, went to university and they are working, contributing to the economy. Then obviously you have those Down syndrome that you need to take care of them. So but antenatal is sometimes it's difficult to pick up which grade it is. So that's when it becomes an ethical dilemma. It's also difficult for parents to make that decision.
From the basics, Doc, so here we have a couple expecting their child to come onto the earth. What is that process? When do you pick up and when do you do these genetic testing?
So there are a series of them, because when you do prenatal genetic screening, we do the first trimester screening. You got a screening test. The screening test will just tell us that there is a risk that this baby might have a Down syndrome or might have any chromosomal abnormality, but it doesn't diagnose it. You understand? So those are now like what we do in the first trimester. In the first trimester, between 11 weeks and 13 weeks, 6 days, we do what we call a knockout translucency scan. It's a sonar that we look at the baby at the thickness of the neck. Usually, sometimes it will be more, the space will be wider in case where you are suspecting chromosomal abnormality, but it's not diagnostic. It will just give you that this baby might be at risk.
Yeah.
Then we combine with some blood tests that we do around that time. It will still give us at risk. Then, in case now that we pick up that the mother screened high risk that the baby might be a Down syndrome or might have any chromosomal abnormality, then we offer them that we call diagnostic test. And the diagnostic test involve taking a bit of fluid from the amniotic sac. Then we take it for testing. That will confirm if the baby really have a chromosomal abnormality. So we get screening tests like the one that I'm mentioning, which we do an ultrasound and we do blood. Then obviously diagnostic tests where we need to take amniotic fluid from the fetus. Other screening tests, like now medicine keep changing. We always have new technology coming up. Now we have what we call non-invasive prenatal testing, which involve actually just by taking the mother's blood as early as about around 11 weeks. If you take just your mother, you will be able to pick up a fetal DNA.
Yeah.
Then that fetal, in case of any chromosomal abnormalities, Down syndrome, trisomy 18, trisomy 13, will be able to pick up from that DNA that this baby might be at risk of having this chromosomal abnormality. And its sensitivity is about 99%.
Wow.
So now that's what we call non-invasive prenatal testing, which means it's non-invasive because we're just doing it by taking the mother's blood and you'll be able to pick up the fetal DNA.
Amazing.
Obviously, currently it's not yet approved by our medical aid, but we offer it to patients who want to do it, and it's costly. It's around about 6,000 to 7,000.
Yeah.
But it have a 99% sensitivity, so it's better than doing an ultrasound and bloods. But again, it's not also diagnostic. So for us to diagnose if the baby really have any chromosomal abnormality, we need to take that amniotic fluid from the fetus, then need to confirm the diagnosis.
So once you take the fluid, doc, and the results do come out, positive, let's say that there is a chance. What is the process from there? Or how does the family deal with that?
Yeah, so we have now to counsel, and it's a counseling that involve me as an obstetrician. It's a counseling that we must involve sometimes a psychologist, because it's not an easy news to break to a mother that the baby that you're carrying might have Down syndrome, and we have seen several grades of Down syndrome, but unfortunately I will not be able to give you an answer and say, oh, this baby, I will not know how functional they will be, but I will tell you that the baby have Down syndrome. So it's a bit difficult, and also for us to counsel the mother, because there are a lot of unanswered questions that I will not be able to give answers to, and it's only when the baby is born I'll be able to tell, oh, this baby is actually cannot do anything, and they will see how as they grow that they be delayed milestone and all that. Yeah. So, but still, based on according to our constitution, a mother can be offered an option to decide if they want to continue the pregnancy or they would like to terminate. Yeah. Which is a very also difficult.
It is very emotional, doc.
Yeah.
But the rest of the physical up until giving birth is exactly the same.
It's exactly the same pregnancy. If the mother decides to, we have parents who have decided to continue their pregnancy, gave birth to beautiful babies. Exactly, and it have happened. So if the mother decides that I want to continue with my pregnancy, we followed up as we do with a usual pregnancy.
Yeah.
Yeah.
Great. Doc, it's very uncomfortable to have these decisions or in discussions as well, but you go through it every single day, and that's why we have these platforms to make sure that we inform, the patients up front. Any final concluding remarks?
Prenatal testing, prenatal screening, it's offered to everyone. Doesn't mean we only offer to women who are at high risk because of their age or any other medical condition, but any other woman who is pregnant, we offer them prenatal testing. And it's as much as it might be uncomfortable knowing, to also bring that, because when a patient is aware of whatever condition they might be expecting, to prepare them emotionally, prepare them family, and also that we are expecting a baby and the baby might have this condition. So it's always best to do it.
Yeah. Doc, thank you so much. We appreciate the excellent work that you do. And next time we'll be back with another episode.
Thank you.
There you have it. So Dr. Simon Emvula giving you information that you need to know. All you have to do is comment, like, share. And if you know of a family that's going through the same, feel free to share the word and maybe give us some contributions as well. We'll be back next month with the next edition.